colon cancer screening and diabetes. So, Black Panther, this was a Marvel movie from 2018, and it was sort of a blockbuster hit. And you remember the character, the Black Panther, that was Chadwick Boseman. And he played the king of Wakanda, and they were fighting over vibranium and all this stuff, which is an advanced technology to get superpowers and whatnot. And the film won 3 Academy Awards, and it was great. So Chadwick Boseman was the Black Panther. That movie came out in 2018, and there was a sequel in 2022, Wakanda Forever. And Chadwick Boseman wasn't in it. He was the Black Panther. So here's the story. The story is that Chadwick Boseman was actually diagnosed with stage 3 colon cancer back in 2016. So that was way before the movie came out. Like, the movie came out 2 years later. And then he progressed to stage 4 cancer. So stage 3 cancer is pretty advanced cancer. So he had stage 3 cancer in 2016. And then by 2020, actually before 2020, the cancer had progressed to stage 4, which is basically end stage cancer. And he was working throughout that whole time. So while he was making the movie Black Panther, he was already sick with stage 3 colon cancer, which is pretty severe. He had had multiple surgeries and he was going through chemotherapy, which is pretty amazing. He's a pretty good actor. You wouldn't have even known he was sick. And the story is that a lot of people didn't even know that he was sick. Only a few close friends and family members actually knew about his illness. In fact, the people who were making the movie producers and the directors, they didn't even know he was sick until he was dying, which is pretty crazy. So he made other movies during that time, like Marshall and Ma Rainey. This guy had advanced cancer. He died on August 28, 2020, and he was only 43 years old, which is really unfortunate. And we were all shocked when we heard the news because we didn't even know he was sick. He did such a great job as the Black Panther. So why is this significant? This is significant because colon cancer screening, or colon cancer itself, it's one of the most treatable cancers, which is why we start screening for it early. I'm not exactly sure what happened in Chadwick's case, how he wound up with stage 3 cancer, but that's the story. And so he was not in the sequel Wakanda Forever, and they actually paid tribute to him because he died in that movie, and it was all about his death at the beginning. If you haven't seen it, it's worth a watch if you're into Marvel movies and such. I really like superhero movie stuff, so I'm into all of that. I don't read comic books, but I do watch superhero movies. But that's the story there. So that is the tale of the Black Panther. It's an unfortunate, sad tale because he died so young. So, colon cancer. So, like I said, it's one of the most treatable cancers. And we actually screen for it depending on which guidelines you look at. So I'm internal medicine, so we use the US Preventative Task Force guidelines. It used to be, they said, start screening for colon cancer at age 45. And there's still some recommendations, which are B recommendations. So those are sort of like second class to start screening at age 45. But we start screening at age 50 now. So anywhere between 45 and 50, depending on which guidelines you use. That's when we start screening for colon cancer. If we catch it early, it's really treatable. In the screening, what they're looking for is polyps. And so these are little growths that are precursors to cancer sometimes, and sometimes they already have cancer in them. And then if we catch the polyps early, those can be taken out, and then progression to cancer is prevented. But it has to be done early. If it's not done early and the polyps stay there and grow and turn into cancer, then they can grow and then possibly metastasize, spread to other parts of the body, which is not good. Those are the guidelines for colon cancer screening. So we screen between ages 50 and 75. And we're going to talk about the tests that we do for colon cancer screening too. So there's different kinds of tests. If you see your primary doctor regularly, they've probably spoken to you about screening. And if you're already having symptoms in the GI tract, like you're having problems with changes in stool habits or blood in stool, that is automatically you're going to go for colonoscopy because we need to see what's going on in there. If there's a family history of colon cancer, then automatically you're off of this schedule and you're getting screened as soon as possible. There's a stool card that's done. That's the FIT test, and that's a mail-in test for some, or some you drop it off at the lab, and it has instructions, and you just put the stool sample on the card and send it in, and the lab evaluates it. There's the stool DNA test, which is commonly known as the Cologuard. I believe there's ads for that now, and you get sent a bucket in the mail, and the whole bowel movement goes in the bucket, and that is sent off to the lab, and they screen that for colon cancer. Now, with these methods, you're not having to go under anesthesia and going under a full colonoscopy, which we're going to talk about in a second. However, I will let you know that if any of these tests come back positive, then the next step is to go through the full colonoscopy. With a flexible sigmoidoscopy, they're not looking through the whole colon. And so for the most part, you don't have to be under anesthesia for this. They're just looking at the last part of the colon, going from the rectum to the sigmoid colon. So that's on the left side. So the disadvantage of this is that they can't see the whole colon, right? They can only see what's on that left side of the colon that they're looking at. But if they do find polyps there, then they get to take those out. A colonoscopy, that's the most definitive test. That is done every 10 years. And with this, you have to have a bowel prep, which the gastroenterologist who you have to go see to get this procedure actually done gives you the bowel prep, and you take it. And basically, you're having stool the whole night until you're clear. So diarrhea until it's looking like water, because they need to be able to see the tissue in your colon. If you have an inadequate prep, that often means needing to repeat the colonoscopy sooner, possibly within the next year, because they weren't able to see all the tissue in your colon very well. So it's really important to get the prep done exactly as recommended by the specialist. Studies have shown, and there's a recent study that came out that showed that people with diabetes are 40%, have a 40% higher risk of colon cancer compared to non-diabetics. And diabetes is just one of the things that has higher risk of colon cancer. So having a family history of colon cancer puts you at higher risk. Like we talked about, certain other conditions like obesity puts you at higher risk of colon cancer. Having a smoking history increases the risk, and heavy alcohol use also increases the risk. So for people with diabetes, especially if you're recently diagnosed and within the first 5 years of diagnosis, that's when it's the risk is highest for getting colorectal cancer. It's really important to be up to date on colon cancer screening. And in this study, it was found that the diabetics were at higher risk compared to the non-diabetics. And they looked at about 55,000 people for this study that was conducted from 2002 through 2009. And there's some ethnic groups that have a higher risk of diabetes too. In this particular study, there was a high proportion of African Americans. African Americans are at higher risk of colon cancer, and so are American Indians. And so that's something that these racial groups need to take into consideration. That's basically what we're talking about today. So colon cancer screening, it's really important for everybody starting somewhere between age 45 to 50, and even more so if one has type 2 diabetes, because that increases the risk for colorectal cancer. So hopefully everybody is on track to get colon cancer screening done, or has already had it done. So thanks, guys, for showing up today. Hopefully you learned something about diabetes and colon cancer screening and why it's important. I know a lot of times people say, well, I don't want to have a colonoscopy. That's fine. At least get some kind of colon cancer screening done, and just know that if it's positive, then you really do need to go on to the next step, which is the colonoscopy.